Good afternoon. Welcome to Dr. Mary Starr, the Total Wellness Doc, and we have Wellness Wednesday. So I am excited to be here with you today. I hope you are watching that. Did you just see what's outside? Let me show you real quick. We are, you see how like hazy, I don't know if you can even see, but it looks orange. Does it look orange to you out there? Yes, we are in Silicon Valley and it's like this, all the smoke has come and it's like you can't even see the sun. But anyway, I showed you this morning in my Facebook stories. Let's get started. This week's Wednesday Wellness, we wanted to play tribute to a long time client and family friend who did pass away, Mr. Grant Decker. We just want to show our condolences for him and his family, and I want to bring him to your attention because not only was he a fabulous teacher at APW school in Central New York, but he was a coach, a Syracuse youth coach, basketball coach for 40 plus years. And the reason I really admired Grant is because the last time we talked, he was probably on 15 years straight of going to the gym and working out every single day, not taking one day of rest. He was a great, great man. He was really highly loved by so many people, and he will be very sadly missed. And we are doing a special donation to his scholarship fund for APW school, which for those of you who don't know, APW is a very rural area. It's a very low income. There's a lot of poverty. And so this is a great cause too. So it's sports scholarship. His checks may be paid payable to APW CSD with Grant's name in the memo. Attention Danielle, P.O. Box 97, Parish, New York, 13131. So our company will be donating. If you know Grant or you feel led to do that, we hope you do. Well, every Wednesday Wellness, we like to bring to you before we start, because we give hundreds, if not thousands of dollars of good education every week, whether you're watching the replay or watching us live. And this week we wanted to highlight, in fact, I have the book in the other room. We're going to just be doing a little unboxing. And this is a very special woman. Her name is Jen Horling. Let me pull this out. And she just wrote a book and basically started a movement. And she wrote a book. Let me just go get it for you, okay? Hold on one second. I have another author on here too. She's awesome. Aisha, say hello. Okay, I got it. Okay, I'm back. I was reading it on the couch. Okay, so this is called Finding, not my, but his voice by Jen Horling. And I'm about a quarter through it. She is an incredible woman, creative designer, just amazing. And I met her probably about 2 years ago with some specific training we do. And I remember watching this woman just really transform her life. So I was really excited to see her come out with this. And she's really, her message is this, that we all have a story. And so she created this little movement. And not only with her book, you can get, of course, a journal, and how so many of us are overcomers. And just a neat little note that talks about, thank you for you, advocate, for choosing to partner with us. Welcome to the Overcomers. As an ambassador, we couldn't be more grateful you've decided to link arms with us. Together we can change the world one life at a time. And this is kind of their mission statement. We believe in the power of story. We believe in your story. And that's so true. You know, if you ever take the time to really listen and talk to people, you really do have a story. And this is a neat little bracelet. So neat. All the packaging she did for this. It gives you kind of the instructions on how to use it. When negative thoughts occur, flip ban and read message. Think positive, feel good. I love that. So let's try on. So it's a little bracelet. It just goes on. It's kind of a neat design. You can see. And then you can flip it over. And it says overcomers filled with gold. Very cool. Very, very cool. All right, so back to our class today. Thank you, Jen Horling, which doesn't even know we're doing this, but we just thank you for what you've done and put out. So let's get started about pain syndromes and doing that. Last week, or in a couple weeks ago, I shared with you a story, and I'll start with this story. A young woman, she was in her teens, I believe, and her family had spent over $25,000 out of pocket, over and above what their insurance is paid, looking for the reason of why she was having dizziness, issues, you know, headaches, dizziness, all of that. They couldn't figure it out until they went to a chiropractor, and it was diagnosed as trigger points here in this muscle, these muscles called the sternocleidoid mastoid muscles. Okay, so a few treatments, and this woman, you know, a few $100s, and this woman had huge relief after her family had spent $25,000 above and beyond what the insurance did. And so many times when it comes to pain, we do two things. One, we take, or maybe three things. One, we take some kind of pill, Tylenol, ibuprofen to get rid of the pain, right? Nobody likes to be in pain. But a lot of times it's our bodies telling us something's going on, right? So we always try to take care of it. So I've met lots of people who've been in pain many years, and their stomachs are ruined because they've taken so much ibuprofen. Their liver's ruined because they've taken so much Tylenol. Like, what was causing the pain? What's the problem? Oh, I was sitting at my desk the wrong way all this time, and getting a different chair and having my head up look straight. Wow, I'm out of pain. You know, simple things like that. The other thing that I see with many people, especially those of you with high pain tolerance, is you ignore the pain, right? So you ignore the pain, you just avoid it, you live with it, you're a little more miserable. Maybe people around you know, but you just live with it. And the third thing that we find many people do is they will go to doctor after doctor after doctor, usually the more traditional, and the doctor will prescribe a medicine. They might do a little, maybe some PT, depending on what their view is, right? To every hammer, there's a nail, right? So me, being more in the chiropractic field, natural health field, I see things more naturally. But I also have 20 years of working with clients, with patients, and hearing stories and seeing things. So that's what I come to you to bring this to you. So one of the things to understand with pain, and this is why I don't believe the third option is the best, is because usually there is a simple answer, right? Usually things like posture, the way, something as simple like how many men did I see in my practice, they would put their thick old wallet in their pocket and they would get sciatic pain because the sciatic nerve was right under that wallet, pushing on that wallet, and they would get pain down their legs, of course, right? You're driving all day, sitting on your wallet, you're going to have those things. So it's really important, especially when we drive or when we're standing a long times, that we do have strong core, but also, you know, is there anything making us, you know, tilt, whatever, that can cause some of our back issues and pain issues. All right, so that's why I don't believe that, I believe that we should start simple. I believe that chiropractic and massage, stretching, yoga, things like Pilates, all of that are sometimes a much better choice. Even some personal training can be a much better choice to get your body strong. So let's talk about some pain syndromes, particular types of pain syndromes. One thing to understand about pain is how it fires up into the nervous system, right? Is that many times when you actually feel pain, the problem's been there a long time. Because especially those of you who don't have pain a lot, it takes a lot of firings to get up into the certain part of your brain for you actually to feel pain, particularly in chronic issues or even acute, not necessarily, but for you to feel that pain. It's actually in the same pathway as tickling. Yeah, same pathway as tickling. So when you say one day, well, I went and picked up that pencil or picked up my toothpaste that fell and I threw out my back. Well, probably the problem had been there a long time. In fact, probably your core, right, your belly area, your back area has been so weak for so long that it has had a lot of things. It has had a lot of inflammation and things like that. And then it just went past the threshold and now you're in a lot of pain. But one of the things that we need to understand is pain can come from a few different things, right? In the chiropractic world, we believe the body can be dysfunctional, right? The joints can be dysfunctional due to stress, due to toxins, and due to trauma, both micro trauma, like sitting the same all day long, or a more acute kind of trauma, like a whiplash or something like that. So the important thing to understand, and let me just hold on one second, I've got to share this with my groups right now. One of the things to understand is that sometimes the trauma can be irritating the muscle, right? Or you can have an irritated muscle. Have you ever worked out and had sore muscles, right? Sometimes the muscles, the joints or the ligaments can be irritated, right, or inflamed, and that can actually fire into the nervous system and cause dysfunction in the organs. True, absolutely true. And I've given you examples about this before. Certain areas like this part of our spine, the thoracic part of our spine, if it's in a lot of dysfunction, it's locked up, it can cause firing into the part of the esophagus that should be squeezing down and holding your food in, and it doesn't. You know, it's just not getting good messages because of the dysfunction in your spine. And so that'll stay open, so people get a lot of vomit, burp, a lot of indigestion, things like that. They get that area adjusted. Wow, I feel so much better. So that's an example of how dysfunction in the spine. But another thing too is that I want to talk quickly about today is how muscles, particularly trigger points, right? We know trigger points, it's like, oh, that's sore right there. If you ever had a massage or someone came up to you and like, oh, I didn't realize I had that pain there or something. Trigger points can actually cause pain in other areas not even associated where the muscle is. Okay, so I'm going to show you some examples of this today. All right, so the other week I had a girlfriend come over and she was having really bad back pain. And she's like, Mary, I don't think it's because I've been working out. I don't think it's, you know, I've been stretching. I've been doing all these things. So can you see this picture here? Okay, so this is called the iliopsoas. And this is a muscle that attaches from your spine. It goes through, basically like through your stomach and connects down here to this part of your leg. That's right. So people who sit all day, this gets very shortened. This gets very shortened. Or if you're doing a type of exercise like, even like sometimes like ellipticals or stair climbers or something like that, this can get a little bit shortened. If you sleep in a curled up fetus position at night too, this can get shortened. And it can cause, sometimes it can cause a little bit of back issues, right? And you can see all these are the lumbar vertebra that's attached. So if this shortens up, what will happen to the spine, right? It can curve over. Sometimes it can twist. It can be dysfunctional. So what we did with her when she came over is I worked on her back. And so a lot of chiropractors or massage therapists, they always work on the back. But the area that I teach, and I've taught in some of my videos before too, is the stomach. Why we need to be working on the stomach and going through the stomach. So I was massaging her stomach a little bit, and I knew exactly where this muscle is. And you can all find it. If you find your belly button right now, find your belly button, and then go down to your hip and feel where that bone is, right? It's the iliacus. So kind of find your hip, find your belly button, and in between that point, in between there, you can put a little bit of pressure in, and you can feel, well, you probably won't be able to feel, but you'll be putting pressure on this muscle. So we kind of dug in, and I put pressure on that muscle. And she's like, wow, my pain went away. Because that was most likely causing her problem. So back pain can be from a lot of different things, but today I just want to talk about muscles being tight and trigger muscles. Okay, so did everybody get that? So this, if you sit all day and stuff, it can become very tight. And you can look up stretches for the iliopsoas. Okay, for those of you who do yoga, like pigeon, and some other things like that, that can be very good. But stretches for the iliopsoas. And it's another reason why I like Pilates, because it really does stretch out the body. Sometimes when we're lifting, we're doing a lot of squats, we get really bulky. Like here, I don't know if you can see, but kind of like in this area, right? Do you feel like you have a lot of bulk in here? And like a lot of those stretchings and Pilates will get us nice and lengthened in that area. And that also does our iliopsoas. So the iliopsoas is going to attach in here to my femur, right? And it's going to go through my pelvis up into my back, attaching to the anterior portion of my back. So I'm going to find my belly button. I'm going to find my hip, right? And in between there, I'm going to just push in, give myself a nice little massage in there. Okay? So now if you have any issues with your spine or things like that, may not be a good idea. Or not, I don't mean spine, but like, you know what you've got going on with your health. And it's a little sore, especially because it's close to the gallbladder, right? And a lot of people's gallbladders is inflamed. Bellies are just a big area. And then I'll do this area too. So go to this side. Belly button here, come in, and just come up. Put some pressure on it. Another area in that is called the iliacus. Let me see some of the iliacus. So this, you have to have bent knees, and actually this is probably better to do lying down with your knees bent, right? So you can come in, and a good massage therapist can do this. And this, you need probably loose clothes on and stuff too. But you're going to come in off of this iliac bone here, and you're going to scoop in, because there can be little trigger points, because there's muscle all around that pelvis, those pelvis bones, and they can get little trigger points and cause some pain issues too. And in fact, women, most likely, if you're going to do some of these belly massages and things that I've taught you, probably going to have better female times of the month too. So that's one area. Another area for trigger points that we see a lot too are in the pec area, because this is like, right, we're rounded shoulders a lot. Women, we have, you know, chest, and we're wearing these bras and causing a lot of issues. So in men, if you're lifting and stuff like that, and then one day you're like, oh, I feel like I'm having a heart attack, or you're having pains in your chest, a lot of times that can be just some trigger points. So a lot of times it's good just to massage, starting from the clavicle. You feel the clavicle, right? The sternum here, clavicle. This is just a great area. Start on top, do maybe one side at a time. Don't press too hard. You can get some nice, maybe massage oil, with some nice essential oils. And this, your trap muscles here will be really tight for most people. But we're just focusing on the front. And then go under the clavicle, and then go in You can kind of feel the sternum. I do this a lot on, well, I don't do this a lot, but in my practice, what you do, they teach you in chiropractic school or massage school, you just have someone cover up their chest. If I have any actual therapist out there watching, you have someone, you know, make sure they cover up themselves or use a towel and stuff. And then you just come in and you get in those areas and just open that area. And it's really important for women especially, because when we are so tight and we're wearing these bras, and men too who work out a lot, if you don't open that up, you're not going to get good lymphatic flow. Like honestly, just doing that, I feel like I can breathe better. What's happening right now where I live, there's so much smoke, some of that people who actually smoke cigarettes and stuff, they'll have much more tighter, or those of you like my friend is in construction here, that if you're just around a lot more pollutants, you're going to have more tighter ribs and rib joints. So it's good to give yourself a good massage, like, oh, wow, that's a tight point in there, you know, going on, and you're just like, oh, I can breathe. So last time I did this for one of my VIP clients, she was like, oh my gosh, like, I feel like I can breathe so much better. And it's so true. Like, I just feel it in those pressure points alone. So really important to do that. Let me see if I can find a couple pictures too that highlight some of this. Oh, I found some good hand ones. Yeah, I don't know if I want to show you this, but even like simple trigger points on the front of the thigh, like if you're working out a lot and you have front of the thigh pain, that can even refer pain, like the trigger points in the front of your thigh, but the pain is somewhere else. Like if you're having a lot of like even perineal, right, in the like where your sex organs and stuff like that, that can just be trigger points from coming from the quad. Now somebody said I have a lot of thoracic pain. Well, thoracic pain can be for a lot of things. For us women, it has a lot to do with our chest, right? We have the rounded shoulders, we have a lot of weight here, and I'm not going to advocate breast reduction, you know, or things like that, but I know people have had to have that and they've gotten a lot of relief. But I would start with some simple, good chiropractic care. If you have a bigger chest, you're most likely going to have more chiropractic care, more massages. You're going to have to do more yoga. You're going to have to make sure that, you know, you're not sitting at a computer all day long. You're making sure you're stretching back and doing those massages. I'm telling you, like, I feel so much better just that alone. All right, let me show you a couple more pictures. Headaches. Right? How many of you have headaches or teeth pain? Look at this. So the X represents where the main trigger point usually is, and the red represents where the pain goes to. Right? So this is a common area. A good therapist, good PT or massage therapist too, we learned technique where we would like do these trigger point release, or you put our finger in and just swipe like the back of where the jaw, kind of the two teeth come together, and do that, and that would help release a lot of people's like ear pain. Yeah, it's just so amazing. So there's a lot of different trigger point techniques out there. There's a lot of different tools and things like that. This is the one that I took years ago. It's called Receptor Tonus Technique, also called NIMO, by Dr. Sheila Laws. And basically we went muscle by muscle, and we would learn, remember I talked about cardiac arrhythmia, people, this mimics these trigger points in here, make people feel like the pain can be intense in the chest, literally make people feel like they're having a heart attack, but they were trigger points. Now, of course, if you think you have an issue, make sure you get checked. But I just think that this should be one of the first things. Now, here's a good one. How many people do you know have carpal tunnel type pains or radiation into their hand? This is common with a lot of hairdressers too, because these, and secretaries who are using their hands all day, these type of muscles get so tight in the forearms, or you know, the forearms front and back and stuff too, that it can cause referring pain down into the hand. And all we have to do is strip out these muscles, right? Strip out these muscles to get that release. And some of my patients, maybe my old patients that I saw in Central New York, remember I would work on your wrist, I would work on your elbows and stuff like that, just to give you some of that relief that I'm talking about. So I could go on and on and on with all the different things that we see. Oh, traps. This is a common one, right? And you see the referring pain out here and here. And that's why recently when I have and still have a little bit of my own back pain going on, shoulder pain and stuff like that, I know it's a trigger point because I can go in and massage that area, right? Like no pain. Get rid of that trigger point. Now it keeps coming back. So I don't know, maybe it's something, it's part of my diet, maybe it's inflamed, something like that, but just really good. So one of the things I recommend using on sore muscles sore muscles, you know, those trigger points, I like to use therapeutic essential oils. My favorite and my favorites, I should say, that I've used for 20 plus years are Young Living essential oils. I like them because they get results, they work very good, and you don't need a lot. This is another favorite. Remember, we're showing some trigger points in the head. This is called M-grain. So it's a great, great oil to use on those trigger points, those sore muscles, right? And I could go muscle by muscle by muscle. Another old standby is just peppermint, right? Just peppermint. Or we have something called Panaway. Dr. Lisa, who she works with horses all the time. She runs basically a little ranch. She uses that in her equine massage with horses, right? It's just something very simple to use a little Panaway on those muscles. Now, here's the thing though. If you use the oil on that area and you're not seeing a result, then most likely, right, that's might not be the area where it's a problem. So since I've been feeling it like in my neck and down here, I was mostly feeling it actually in my neck and my kind of cervical thoracic area. But when I went out to this, right, that trigger point, trapezius trigger point, and pushed on it, oh, okay, now my neck is fine. How cool is that? So that trigger point can take away the neck pain. So do you see what I'm saying? Like, oh, I've got a headache here, but the problem could be back here. So that's what I'm trying to say to you, is that you can take the pain meds when you get pain, right? Or over-the-counter pain medicine, and the pain will probably go away, but the problem hasn't, right? It might relieve some of the inflammation, you might feel a little bit better, but the problem hasn't gone away. Second thing, don't avoid it. Your body's trying to tell you something. It's saying, hey, stop sitting all day. I was sitting on my heating pad and stuff all day. That was not a good idea for me yesterday. I feel much better. I got a little exercise today. I feel, you know, the blood is circulating, flushing the inflammation. But listen to your body. Don't ignore it. And the third thing is always start with the simplest answer. And I truly believe that chiropractic care, I believe that massage, even your own massage, using a little peppermint oil, using M-grain or Panaway oil, any of those, I think they're simple tools that you can use. Lisa says, I haven't taken any pain meds over the counter in years. I use only oils and Epsom salts and lavender for me. Really, really good thing too. Maybe another time we'll talk about magnesium and Epsom salts and how good that is for you too. So I hope this was helpful. I hope your next step really is to think, okay, next time I have pain, what could it be? Do I need to stretch? Do I need to get to my chiropractor, right? And one chiropractic adjustment isn't going to fix the muscles, right? And one massage isn't going to fix the muscles. You got to take responsibility. You've got to do the work too. You've got to stretch. You've got to strengthen. For a lot of us, it's about core strengthening. I was having some pain too, and I just tightened my abs. I'm like, oh, pain's gone. Look at that, right? Look at that. So you got to take responsibility, step up. If you'd like to know more about essential oils, I am here. If you don't have a consultant, or Lisa's on as well. She is an amazing consultant in the Texas area, but she helps people all over the world, and very, very good for equine therapy and knows so much. She has some great programs on making your horses the healthiest they can be, and some other particular things that are very, very good for a horse's muscles. She knows so much. There's so many great advocates and wellness advocates out there. I hope this is helpful for you. Your next step is make sure that you invite others to subscribe to our YouTube channel, and so they get these weekly wellness videos. I will be taking a couple weeks off here in September, going on vacation, but hope to be back in October. I hope you have a great day, and thank you so much. Bye.